Do you struggle with middle back pain? And by middle back pain, I mean pain that is originating around, if you're a woman, where your bra strap should be. So it's in that middle portion of your spine. If you do, and you're an office worker, there's every reason that something that you're doing inside of the office is the cause of this complaint. The pain that you experience in this area may not occur while you're sitting at work though. You might notice it during a golf game with your golf swing. You might notice it when you're exercising at the gym. You might notice it when you're sleeping in bed at night. Pain in your middle back area that occurs outside of the office can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor static postures. And where do you do most of those? At work, of course. So it's really important to consider the ergonomic, the postural, and the behavioural elements that you do every single workday that may be contributing to pain in this area. So let's have a bit more of a talk about the anatomy of this area so you can understand how it works and how sitting at work is vitally important to the functionality of this area. Let's talk about the anatomy of your middle back and how it's designed to work and what sort of issues and problems you run into in terms of aches and complaints in this area for the average office worker. The middle back complaint in an office worker is reasonably common, and there's two elements that you need to consider. First is your rib cage and second is your vertebra. So the rib cage we'll start with because it's actually probably the most common cause of middle back complaints in an office worker. When we sit, what should happen is our ears should sit over our shoulders, which should sit over our hips. We should be nicely balanced from left to right, and we also should be nicely balanced from front to back. And when we maintain good sitting posture, this is the position that we're in. Where you run into trouble with rib complaints through that middle back area is when we start to translate our body or when we start to twist our body. So you've got to think about your rib cage almost like a barrel. You've got your sternal attachment at the front and your vertebral attachment at the back. And you've got it like your rib is massive. It's a bone, and so it connects from here all the way around to your back. So you can imagine, because it's got this barrel-like appearance, if you make a change on the left, it is going to affect the right and vice versa. Ribs become problematic because of their attachment to the spine. When you think of most joints have a really strong buttress finish, and it means that the joint is quite stable and not really susceptible to having too many issues with strain levels. The problem with your ribs, particularly through your middle back, is that the ribs articulation with the spine is that the rib doesn't really have a strong attachment to the spine. The rib almost just sits off to the spine like this, and that's where the rib's positioning is. This is fine for breathing and doing minimal work, but the problem is when you start to twist or translate, what you do is you have the capacity to slip through the rib, through that joint, or you can strain the rib, either way. So the rib's articulation to the spine makes it vulnerable to these sorts of movements. And they're the sorts of problems that most office workers have in terms of middle rib complaints and middle back complaints. It's the rib which is actually getting grumpy, and it's generally because of a poor translatory load through it. The other consideration is your vertebra. Facet strains, disc injuries, just achy discomfort that you want to jam your knuckles into at 3 o'clock in the afternoon. If you feel this discomfort in this area, it's essentially your body trying to tell you that it's not happy about something. And that's generally because you're putting a more load in through that section of vertebra than it's designed to cope with. When you sit up nice and straight and your ears sit over your shoulders, which sit over your hips, the weight of your body is evenly balanced throughout each of your vertebrae in terms of your spinal alignment. However, when we slouch or when we sit with our bum halfway down a chair, what you do is you change the apex of your spinal alignment and it centers in through that middle back complaints. So if you do struggle with pain and discomfort through this area, those poor postures can absolutely put strain on your facet joints and through your discs and also through your ribs, which can lead to chronic pain and discomfort through this area. Let's have a little bit more of a chat now about the ergonomic, the postural, and the behavioural elements of specific things that office workers do that cause middle back complaints. The first consideration in terms of middle back pain is when we have our backrest too reclined on our office chair. Fundamentally, what should happen is when we sit, our ears should fall over our shoulders, which should fall over our hips. As a result, you need the backrest in a position to maintain this alignment. The further reclined your backrest goes, the more you have to flex through that middle back to maintain a reasonable position relative to gravity. The further back your chair goes, the sharper the angle that has to be formed through your thoracic spine for you to be able to continue to view your computer monitors. If you do suffer from middle back pain, that the backrest is set to 91 degrees in a really upright position. In a similar vein, not having the backrest of your office chair in a locked upright position can cause middle back pain. The problem is when we sit all day in an office chair, it's actually really fatiguing for our back. So we really need the support of a backrest to maintain that position comfortably over the course of the day. If your backrest isn't in the locked position, in that if you lean on it, it gives under your weight, you do not have the support of the chair to maintain your body weight over the course of the day. And then as a result, we collapse and slouch into our torso. It's really important that, again, the backrest is set to 91 degrees and it's locked in position. Having your monitors too low can also contribute to middle back pain. When we sit at our desk, that all of our computer monitors are at eye level. If we're having to look down to a monitor, what will happen is our head, our neck, and then eventually our torso will follow that direction of sight. What tends to happen is we end up with this really big hinge point through our middle back to maintain this forward flexed position. It's really important that when we look at our computer monitors that we're looking into the top third of them when we're sitting in a nice upright position. We can struggle with middle back pain and discomfort when we sit miles too far away from our desk, like in this image. You can see that I'm having to flex through my thoracic spine and my rib cage to be able to reach the keyboard and the mouse. When we're in this forward flex position, it puts a huge amount of tension and load through that middle back area. It's really important that, again, we keep our chest up and that our entire back is on the backrest. Then what we need to do is we need to push our chair in close enough so that we can comfortably reach the keyboard and the mouse without our elbows leaving our side. The slouch posture is one of the biggest causes of middle back complaints. When we sit and we have nice spinal alignment, we should have this lovely soft C-shaped curvature through our thoracic spine. However, when we sit in a slouch position and we collapse into our rib cage, we end up with a spinal curve which is much, much sharper, and the apex of that curve hinges through that middle back area. When we sit, that we sit up nice and tall, the key in terms of good spinal alignment is making sure that when we sit, we lift our chest up and we have our entire back on the backrest of our office chair, not just the bottom half. Leaning on your elbow can lead to middle back complaints because as we lean on our elbows, what we tend to do is we tend to introduce a translatory force through the rib cage. As we've talked about, ribs hate translation. They like to be in a nice neutral position for most of the time. When we lean on our elbow, we put a huge amount of torsional strain through those ribs, and there becomes a real pivot compressive force through that middle back. At the end of the day, our arms are not load-bearing joints. They're not designed to absorb your body weight. As a result, when you do sit up, you sit up with a nice upright chest and that you let your arms hang passively by your side. Similarly, when we sit with a thoracic side shift, we run into trouble with our middle back. It's not as extreme as when we lean on our elbows, but again, it does introduce that translatory force through that rib cage. Check where your ribs are positioned over the course of the day. It's really important to be aware of not what you're doing just in your workstation, but how you interact with your entire work environment. Middle ribs and middle back complaints can come from when we often liaise with a colleague or there's a doorway that we're regularly having to twist and move toward. Repetitive twisting is terrible for your rib cage. You do liaise with someone regularly over the course of the day that's positioned in a different part of the office, that you turn your whole body to talk to them rather than just your torso. It's really easy to be lazy with this, but at the end of the day, that repetitive torsional strain through your rib cage can cause huge amounts of pressure through your middle back. The other behavioural consideration is when we lean forward on our elbows like this. This can be a behaviour that we adopt when we're concentrating. It may be a behaviour that we adopt because we can't see correctly, but at the end of the day, it's really important that, again, we use the whole backrest. Having your torso in this forward flex position puts huge amounts of strain through that middle rib area and can lead to problems and discomfort through that rib cage. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you. Whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.